Hello, everyone. Thank you for joining us today. My name is Una, and I'm a second-year student at University of Maryland's Medical School. And today, EyeRes is an organization that seeks to create a community to support students in their journey to pursuing ophthalmology. And in today's advice session, we are having a residency panel with the recently matched interns at various institutions across the United States. And we would love to start by having an introduction session. So Grace, would you mind starting?
Yeah, absolutely. So hi, everyone. Really excited to be here. So I'm Grace. I'm a fourth-year medical student at University of Iowa. I recently matched into the New York Eye and Ear Infirmary at Mount Sinai.
Lauren?
Hi, everyone. I'm Lauren Hucko. I'm also happy to be here. Thank you for having me. I'm a fourth-year MD and PH student at the University of Miami, Miller School of Medicine, and I recently matched at Bascom Palmer Eye Institute, so I'll be staying in Miami.
Hi, everyone. My name is Victor. I'm a fourth-year medical student at Georgetown University School of Medicine. I just recently matched at the Shea Eye Institute at the University of Pennsylvania in Philadelphia.
That's awesome. Congratulations to all of you, and thank you so much again for all your time and coming here to give us some advice. I see that someone else has also joined, so please feel free to speak up if you have any questions or leave a message in the chat. If not, I can start by asking some pre-prepared questions.
Sounds good, yeah.
So this is a really basic question, but what made you decide that you wanted to pursue ophthalmology, and when did you decide?
Yeah, so for me personally, I think I had the advantage of thinking about ophthalmology when I came to medical school. I was able to have that advantage because I spent 2 gap years in Dr. Ilya Du's lab at Wilmer Eye Institute, where I was able to do some basic science research in ischemic diseases in the retina. So I actually really had a good experience doing that. I love doing this little flat mount experiments. Realized that I actually really, enjoy working under the microscope, like stuff like that. And I thought retinal pathology was pretty cool and the visualization was pretty cool. So I had definitely had that advantage coming to medical school. And I think my journey would have, maybe looked a little different. Maybe I would have taken a different route. I'm not, exactly sure if I had not had that experience. So for me, that's why I chose ophthalmology. In addition to all the other things, it was really the people that got me started thinking about ophtho, including, my mentors from all the stages of my career so far. But as I got to progress through the journey, I saw and learned more about ophthalmology, and everything about it really hit home, and I stuck with it.
I was also lucky to find ophthalmology early, although I didn't know before med school that I wanted to do ophthalmology or had that interest. I found early on by talking to a peer in the class above me who was interested in ophtho. And I remember she was telling me about a research project that was looking at trends in emergency ophthalmic care utilization during the COVID-19 pandemic based on different sociodemographic characteristics and really seeing who was still seeking care and for what ophthalmic pathologies. And I was really excited because I had never heard of a surgical specialty that was that niche, that really cared about the populations that are using services and really cared about addressing health disparities and health equity. And so she introduced me to that project that I came on board. And through that project, I was able to meet my mentors who shared a similar passion for integrating efforts to advance health equity within to ophthalmology. And then I did similar work and began to go to conferences and really enjoyed the community of ophthalmology. People are big thinkers outside of ophthalmic disease, and I really enjoyed that. So then my next step was seeing if I would like the clinical and surgical side of ophthalmology. So I was able to shadow a lot and do some rotations here. And I did love it. I loved that every day was different. You were not just in clinic and you were not just in the OR. And I feel like a good balance for my own practice is a combination of those two, because I do really enjoy talking to people, understanding what barriers they have to accessing care and accessing consistent medication, and to have individualized like surgical planning, but then I did like the procedural aspect of ophthalmology and I did like surgery. So it was a really good combination of my interests. And then also I was able to integrate my interest in public health into ophthalmology in general. So that was my pathway.
So as far as getting interested in ophthalmology, I think I was very lucky. My first physician mentor, who I got introduced to while I was in college, he's an ophthalmologist, and it was funny. Like he was like just a very similar background as me. Like he's a black physician from my neighborhood in Brooklyn, so like he was like a very strong role model for me for like the past 10 years. So I kind of always had in the back of my mind that I sort of wanted to be like him. When I got to medical school, I just kind of really fell in love with most of my rotations. It was like, kind of hard to pick at the end, but similarly to my colleagues here, I just thought that ophthalmology had the right balance of clinic and the right balance of surgery in a way where like every single day was like sort of a new experience and you get to see lots of different kinds of patients. But even though you have like that sort of high volume, you get to see a lot of different things. You get to follow them longitudinally, which is sort of this almost primary care like feeling that I really like that ophthalmology has. So it was ultimately, even though I ended up liking a lot of things, I just thought that it had the right balance of things that would make me happy over a long period of time.
That's great. Thank you for sharing your responses. So from what I'm hearing, it seems like there was a good balance between excellent mentorship, early exposure, and research. So I think it would be great if we can divide it up, the journey for the first year, second years, third years, and eventually the applicant's process. So for each of the different processes, for the pre-clerkship students, how much does the grades and class rankings matter?
So I think that really heavily depends on institutions and program and schools now, especially with such a diversified curriculum. At Iowa, our preclinical curriculum, it was graded, so it was not pass fail. And that's a really hard question. There is, for objective sources, there is, I think, surveys filled out by directors, program directors, in terms of how they rank the importance of stuff. And preclinicals fall somewhere, but I don't think it's in like the top three. But the advice that I would give to future applicants and, kind of a mindset that I had in the past was, just kind of do your best in whatever you're doing. And, if you're in the preclinical phase, then do the best, because you never know what you're going to learn and how that's going to affect your journey. And that way you minimize the chances of having regrets later, right? So in the end, it's impossible to know how much preclinicals actually matter. And, in the grand scheme of, step one going past fail, the importance may have shrunk over the years, but, just do your best.
So my preclinical curriculum at University of Miami was structured a little bit differently. I was the first class of the rollout of a new curriculum where we had an abbreviated preclinical period followed by all of our core rotations our second year. And so my phase one, which is the preclinical period, actually was not counted towards my quartile. And then my phase two, which was all of my core rotations, including the shelves and OSCEs and stuff, that was the only thing that went into our class rank and our quartile. And they've changed that a little bit since, but I think we were different because it was a pilot year. And honestly, I think at the preclinical stage, I didn't realize the importance of grades and stuff. I think I was more focused on getting through each rotation and doing the best that I could. And I think it's important to push yourself and challenge yourself because being successful academically will not close any doors. But that being said, it's not impossible to get to where you want to be if your academic record doesn't look exactly as you would like it to. I think it's if you're well-rounded, you have strong research, you have good connections, and you've really tried your best, you've showed that you put in a good effort and you've been consistent, then that's going to carry through. But I wouldn't underplay the importance of having those strong objective markers because they're not going to close any doors, and you're still going to get where you want to be. Maybe if you don't have as strong of an academic record, but you might not have the same exact amount of opportunities as if your academic record was different.
Right, and I absolutely agree with everything that's been said so far. I mean, I think my experience might be just a tad bit different because the preclinical curriculum at Georgetown is entirely pass-fail, so there none of those sort of grades or anything makes it anywhere where any program can see. That being said, I always tried my best in my preclinical coursework. Not just simply for a grade, but just so I can learn the material and master it, so I can be a good clinical student. And you know, it's so the way that I kind of picture it is like, if you kind of fall below what your expectation is as far as like your, getting a grade that, you're only you are really going to see it. You're not, it's not, it, having a pass fail preclinical curriculum is beneficial in that way, where it's not gonna, you don't have to sort of beat yourself up too much about it, but you could sort of work your way up and try to, like, strive for improvement. um, a lot of data shows like the better you do in your preclinical curriculum, the better that you do on step one, even though it is pass fail, like the easier it is to do better later on and just get really good at taking these exams, which will be important because step two is for a grade, and you have to take licensure exams later on. So just, trying your best and really trying to master material is super important. It's something that I strive to do, even though my curriculum was pass fail. Uh, that also being said, I think a good way to sort of make use of preclinical time as well, in addition to just mastering material, is if you know that you're interested in ophthalmology early on, like try to like take a few days during your preclinical curriculum to go and get some exposure, go shadow, reach out to people, say, hey, like I want to work with you in the clinic someday, and sort of, you know, just do some reading beforehand, like just kind of know the basic anatomy of the eye, so you're not just going there and not knowing what is going on at all. But yeah, I think that's a really good way to sort of get that early exposure and start making those connections right away, because ophthalmology is a very small field. Everybody knows each other. So the more connections you make, the better.
Thank you. I heard so many important aspects to consider, even as a first and second year students. So to summarize, you should always try to do your best because it's important to build a foundation to prepare for the future step exams as well as opening doors, but don't be discouraged even though you aren't doing as well as you hope to do so. And I've also heard important things about clerkships, extracurriculars, and building connections and networking. So I would first proceed to the clerkships. During your clerkships, how did you pursue ophthalmology interests? Because ophthalmology isn't a solid curriculum that's mandatory. And during your clerkships, how did you make sure, what kind of efforts did you put in to stand out as an applicant?
Yeah, that's a really good question. So core year is really, I think, the key in medical school. That's like, the most important year that everybody really anticipates. And throughout the year, first I kind of majorly focused on the rotation at hand. But on the, whenever I had the bandwidth, I, kind of put my energy towards some of the research projects that I've been working on with my ophthalmology mentors. And I, was regularly in touch with my ophthalmology mentors, even consistently throughout my core year. And yes, there were some times, through some busy rotations where I had to put that aside and really focus on my rotation on hand. But, that flame never really fully went out. So I think that's important. So if you're thinking about ophthalmology going into the core year, and if you have a research project and mentors that you are, speaking with, then I would keep that alive throughout the core year. And they know that the schedule for core year students can be very busy. So even if it sometimes means extending the deadlines or, putting that aside for some period of time, I think it's important to come back to that at some point. The second advice, ophthalmology rotation, I think is really interesting because, at first I fully acknowledge for me, it was a tough rotation because most of the times you're kind of in the shadowing role. We don't have the skill set to actually participate in patient care. So you do have to have some kind of faith, deep down here that, this is something that I am interested in and I want to learn more. And there is some initial roadblock that you have to push through. So don't be discouraged if you start your ophthalmology rotation and you're like, wow, this is really tough. I don't get anything that's going on here. I think that's perfectly normal. And it's okay to, hold on to that faith and just like push on and push through a little bit. Just like Victor said, there's plenty of really good resources online that you can look up to, you can study on your own. And one day, sometimes it begins to hit and, so there are some fun moments down the road.
Yeah, I would completely echo what Grace said about the importance of staying in touch with those mentors whose relationships you started to build prior to your core rotations year, and then just try and work on those projects because A, it's going to help you be able to have those finalized before applications, and B, it's going to show your continued interest and help build those connections. I really felt like I didn't have capacity to interface with ophthalmology clinically when I was in my core rotations. I also am an MD, MPH student, so I did my core rotations at more community hospital sites and actually wasn't living in Miami for that year. So a way that I tried to integrate ophthalmology into my rotations was on my surgery rotation at the VA. Anytime there was downtime, I would go in the ophthalmology OR and I would see like some cataract cases, some detachments, just whatever was going on at the VA. I think it was Mondays and Tuesdays were ophtho days. And that was a good way for me just to learn more and have exposure in kind of a low stakes setting because it wasn't my home institution. I was still learning. I was a second year. And then the other piece of advice about rotations in general is even if you're like, I love ophthalmology, there's nothing more that I want to do, go into them open-minded. I think I knew I had a strong interest before I started, but I didn't want to discount anything else. I didn't want to tell myself, oh, you're for sure doing ophthalmology in case I loved something else. So I tried to give every rotation a very fair chance. And I tried to try my best so I could learn and realizing that it might be the only time I ever do an OB-GYN rotation or a peds rotation or whatever it may be. And I feel like that was able to help me make an impression on mentors and on preceptors and help me do my best and just engage the most with the material. And I had on multiple occasions on my evaluations, people would write like, even though she's strongly interested in ophthalmology, she really showed an effort at getting to understand like OB-GYN and she, you could tell that she was reading and stuff like that. And I think that's an easy way to remain engaged as a med student, to not completely have blinders on to one specialty, because you're going to have other specialties interface with your patients and just interact with ophthalmology in the future. So just try and be excited and show up and engage, because you might not ever see it again, the content in different specialties, but also it's going to help you learn more and help solidify knowledge and just show that you're going to work hard and be open to learning to all of these people that are going to play a role in setting you up for success in the application process.
And I think what you just said, Lauren, is super important because I sometimes unfortunately see some medical students when they think that they're going into a specific specialty, they'll say things on rotations like in front of others, like, "Oh, I'm not going into this, so I don't see why I have to do this or why I have to learn this." Do not neglect your other rotations. Do not neglect your core clerkships. They are very important for a reason, and all I'm doing well in them and learning from them and being fully engaged in those rotations will make you a better doctor overall and allow you to be a better ophthalmologist. Um, other successful rotations outside of ophthalmology are ones where you do so well, even though you're not even remotely going into that specialty, where those individuals are giving you feedback saying, oh, so-and-so would be excellent for OBGYN, so-and-so would be excellent for neurology. That is a successful rotation. And as a fourth year, having done, ophthalmology rotations as a fourth year, I had to do like a medicine sub-I, and, I have to do several months of medicine as an intern. I know that because I engaged in those rotations as much as possible, I'm going to have a strong capacity to do well and better serve my patients because I put in that work. And it doesn't just translate well as far as like your sort of being prepared as well as competence, but it translates very well in people's willingness to help you and support you, not just within ophthalmology, but outside of ophthalmology. And like I said, medicine is a very small um, field, right? So people talk, people are willing to help you connect with other people within the institution, outside the institution, if you show up and do the work, no matter which environment you're in, even if you're outside of ophthalmology. So that's kind of like my advice for core clerkships and non-ophthalmology clerkships. For ophthalmology rotations, I agree with everything that has been said. The first few weeks, it's going to be very confusing. There's not a lot of ophthalmology curriculum in the pre clerkship curriculum. So you're not going to know when they're talking about using all these acronyms and all these words and terms, like you're not going to know what's going on. But the key to doing well in an ophthalmology rotation, in spite of that, is being open-minded and knowing what you don't know and knowing how to get from point A to point B and learning what's happening. So this might sound a little bit silly. I always walked around with a little notebook that could fit in my white coat pocket. Any word that any ophthalmologist says, like resident or attending around me that I don't know, I write it down. And whenever I get a second in between patients or I go home later that day, I would look those words up and I would just write little blurbs of like what that means. So if they say it again, I know what it means. And if I don't remember, I look it up. So each time I'm getting those reps, it's almost like Ankiing in a weird way, but like you're getting those reps on, getting used to the terminology. So then you could eventually participate in the conversations in a meaningful way, right? So I think that's sort of like how you kind of cheat the learning curve a little bit. As far as ways to contribute on a rotation that makes you stand out, knowing how to take a good ophtho history is pretty good, and there's resources on how to do that. I would just try to practice that as much as possible, and don't be afraid to like present to attendings. Like get that FaceTime in. Say, if you're working with a resident, and obviously use your best judgment. Don't slow the flow of clinic, but like if there's a patient that you feel like you've spent a lot of time with and got a good history, ask the resident that you're working with, hey, can I present to the would you be okay with if I presented to the attending, if it's not too much hassle? And a lot of the times they'll say, yeah, like we'd love for you to present to the attending, and they'll sort of run through the plan with you to make sure that you got your story straight. So that's one thing that's really good. And just sort of another hack too is I would say two main important things is I would come early before everyone's there. Literally just play with the slit lamp, get acquainted. And I've learned every slit lamp is different. The worst thing that's happened to me several times is I'm unfamiliar with the slit lamp in the room, and I have a patient in front of me, and I cannot turn the dang thing on. Like that is a struggle. So just come early every day, get acquainted with the rooms, and a lot of the times the techs come earlier than the residents and the attendants to clinic. The techs are super knowledgeable in how to use all the equipment. So ask them questions. A lot of times they're willing to help you learn stuff, and they'll show you stuff. They'll tell you how to turn on the specific slit lamp in the room. And another goal is, like you're not going to be able to like right away on your first ophthalmology rotation always see the retina, or always be able to do like see cell in like on the slit lamp exam or anything like that. But if you can master the ophthalmology vitals, like learning how to take a good vision, learning how to take a good pressure, just confrontational visual fields, like those things, that will be super helpful. When clinic is slow, sometimes you could help out with that, and people will love you for that. So I know that was a little bit long-winded, but those are the things I thought were very helpful for me.
Thank you so much. I've learned so much from your advice, especially as an entering third year student. I feel better prepared. And some of the values that you have all mentioned was consistency in reaching out to the mentors and being engaged in different specialties, because those knowledge would eventually contribute to your role within the ophthalmology department. And little tips such as taking notes in a notebook and trying to present and making friends with the technicians, for example, to learn the little details and be prepared for when you're supposed to present to the residents and the doctors. And then I would like to move on to the OA rotations. So assuming that you have all successfully completed the third year in your home institution, what advice do you have regarding in applying to the OA rotations and excelling while you're at the other institutions?
Yeah, away rotations, I think it's such a hot topic in ophthalmology. So I did an away rotation, and like I said, I was a student at the University of Iowa, and I think whether you should do an away rotation, and if so, where should you do one? That's so individualistic, and that so highly depends on really personal factors and also the programs that you have at your home institution. The only, like the baseline truth that I think applies to everyone is if you don't have a home program, then you should do an away rotation. That's about as all I can say. That's about as absolute as it gets. And outside of that, everything is so subjective right now. So it's really difficult for me to answer the question. But I did an away rotation at University of Miami because of multiple factors, including faculty mentorship, encouragement, and really wanting to immerse myself in a very different environment than Iowa. And I'll say that it has given me several benefits. One, I really learned about the different environments out there. For example, the different styles of teaching and the different balance between kind of supervision and autonomous learning that happens in clinic and the OR. So, and also like Miami has this IED that Iowa doesn't have, and there's some differences in the way that they do things that I really appreciated learning about. And I think it's just a good experience to, immerse myself in a different environment and meet new people. That's how I met Lauren and Victor there. So, and the connections that I, really established during my away rotation really, helped me. And I know that these are relationships that I'll continue to build on. So in that sense, it was really beneficial. Is it necessary for everybody to do an away rotation? Like I said, I don't think it is. And I think that's very, it really depends on your personal factors. And yeah, in terms of how to do well on away rotations, every principle that Victor and Lauren have talked about already, I think really applies. Give yourself some grace, I'll say, in the first few days or weeks you're adjusting to that completely new environment. So it can be very difficult. You're not going to hit off the ground at the same speed as a home student, for example, and that's okay. Give yourself some time to adjust, figure out where to live, figure out what to eat and stuff like that. And once you've gotten that down, I think, really asking home students too, like what resources, how the OR works and stuff like that, that really helped. Lauren really helped me during my away rotation, so thank you. So definitely ask the home students and just be involved as much as possible. The goal in the away rotation, it's, if you want to get a letter of recommendation, then you can consider building, spending a lot of time with one person. Building that longitudinal relationship. For me, I really wanted to just learn from as many people as possible. So that's what I did. And just kind of throw yourself out there. It's kind of the adventure sort of. So yeah.
Yeah, I agree with a lot of what was said too. And I would highlight too, if you have a personal reason why you want to be in a specific state, region, city, absolutely go with it. But if not, if you have a home program, I don't personally think that there's pressure to do more than one away. I think you shouldn't underestimate the power of having multiple people at your institution, even outside of your letter writers, advocate for you, because ophthalmology is a small community and those things are going to really come into play throughout the application cycle. So do not underestimate the value of those relationships, and do not think that being a late third year or early fourth year is too late to build new relationships, because working at your own institution will help strengthen those. And you can even spend time there if you're not on rotations to get to know people. So I'm kind of the school of thought that like one can be helpful. And I think you should do it at a place where you would like to actually go. I know some people play the game of, should I do an away at a safe program that guarantees interviews? I think really use it as an opportunity to benefit from it as well. Like, see if you would like an institution, think of a place where you would like to train and see if that's something that you would enjoy. So you can have some point of comparison to your home institution and know that there's some variability that exists, just as Grace was saying. And then in terms of timeline, I just want to say, like, I decided really late. I wasn't going to do one. And then I decided late to do one. And so it didn't actually work out as I had completely planned. I wanted to do a clinical rotation in the ED of a different institution, and I didn't get that one. And I was offered ocular pathology at a different time of the year. And I said yes, even though it wasn't what I wanted. I said, like, I'm still going to do it. I'm still going to have this experience. I want to get to know the program, see something else different than my home program. And I'm really glad that I did. And I think another thing, you hear this a lot in medicine, is you get out of it what you put in. I knew I was doing ocular pathology rather than a clinical rotation, but it was important to me to still see what the clinical experience looked like in that ED. So in addition to going to the ocular pathology lab, which was about 8 or 9 to 4, not too bad of hours, I would spend nights and weekends, not every night, just like a few nights a week and a weekend half day or full day at their ED, just to get the most out of it and to feel like I was able to really engage with not just the clinical process there, but with the people, with the residents, to see if I would be a good fit, to see see if I liked it. And then also don't underestimate getting to know the city too. That was important. I did a lot of exploring, a lot of going out and about and trying new food and stuff to see if it was a place I would even want to live, because that's going to be important to you as well, to be a successful and a happy resident. And you're only going to be as successful as you are like happy in your new environment too. So I think that was important as well. And then to be prepared, I think take it seriously. It is kind of your one way to interface with people in person, since the interview cycle is now on Zoom. And that's really valuable. Don't be afraid to be yourself. I think we get really nervous in these hyper professional and academic settings, but people want to see that you're a human, that you have hobbies outside of medicine, and that you do things aside from ophthalmology, and that you want to connect with the residents and the faculty you're meeting. So don't be afraid to let your personality come out, to be yourself, and obviously maintain professionalism, but a good balance of those things will help them see who you are. And then also, I would say prepare. Definitely don't go into an away rotation without having done at least one clinical ophthalmology rotation at your home institution. Tell whoever you're working with, whether it be residents or attendings, hey, I'm about to go on this away rotation. And they're going to say, okay, I want to set you up for success. Like, why don't you grab the indirect? We'll practice together. Let me show you this. Why don't you work on your presentations? If you're going to be at this institution, I want to set you up for success. And most of the time, those people are going to want you to do well for yourself, but also because it's a reflection of your home program too. So don't be afraid to tell people that, and they'll help you learn along the way. And then just be prepared and do your onboarding on time, and just show up and have a positive attitude. And that's going to take you guys a long way in the away rotation process. And then truly, I don't think that there's a need to do more than one unless you have specific personal reasons, but everyone has their own opinions about that. I just think another thing to not underestimate is how much time, effort, and energy they take. They are exhausting. You're trying to be your absolute best self all day, every day, and to show up your most prepared, and to do the best, and to stay long hours. And that does take a toll, especially right around the time of applications and interviews. So you have to know your capacity and know that you're not going to be able to show up as your best self if you're overstretched and overworked, or you're doing 2 or 3 in a row along with your home ophthalmology sub-I or advanced clinical elective. So know that as well, and do what is manageable for you to show up as your most successful and authentic self.
I completely agree with everything that has been said. You guys really covered a lot of good points. I'll just add, I guess, like 3 little things. First, as somebody who did 3 away rotations back to back to back, it was a lot. I think that really assess what your bandwidth is. To many students who have asked me this year, how many should I do? I usually say, I mean, it's completely up to you, like, what your goals are, where you want to be, or the specific places you want to be and whatnot. But, if people who say like, oh, I want to do 3, I usually now tell them maybe like consider 2 because 3 back to back to back is a lot. And, I think I could have been okay doing 2. But, with, with my personal situation, I was pretty happy with that I did them because I had those different experiences. And one thing I didn't realize going into it is that I would really learn about the different training styles and the different structures of residency programs. So I thought that was really helpful for me. But so to all the people out there who are like, oh, I have to do as many as possible, no, that's not necessary. 1 or 2 is totally fine and totally acceptable. The other thing I'll say is, like they're sort of interviewing you while you're on their way rotation, but you're also sort of interviewing them. Take notes about how you're feeling about going into work every day. It's giving you information that you wouldn't otherwise have, given the fact that interviews are virtual, so you don't really get to see the institution in person. And even if it was in person, you won't get to see how things are running as much as you do doing an away rotation. So that's also, I'd say, super important. And also just sort of, keep in mind that if you're working with residents, you're working with attendings, just be kind to everybody. These are people who, like they're looking for people who, when like you have to be called into work at like 2 a.m., like who's going to be pleasant when that happens, so be mindful of that. And when I say treat everyone with kindness and respect, I mean everybody, not just the residents, not just the attendings. I'm talking about the scrub techs, the OR nurses, the floor people, the janitor. And it's not just the right thing to do. It's also like, they take note of those things. A lot of, a lot of, attendings care very deeply about their staff and take it very seriously if medical students are disrespectful to their staff. And more often than not, many students realize, attendings will ask staff members, how was this medical student? How did they treat you? Did they treat you with kindness and respect? And if the answer is no, then you have sort of taken yourself out of the running. So it's not just the right thing to do to treat everybody with kindness and respect. They also look for students who care about staff, who will walk into the OR, introduce themselves to all the staff in the OR, and which, you don't want to just walk in there and act like you own the place, or not introduce yourself and have those people be like, okay, who is this person, just kind of walking in here without introducing yourself or getting to know who I am. So treat everybody as your equal, treat everybody with kindness and respect.
That was
Sorry, I just wanted to add one more thing. So yeah, I had the privilege of doing like home rotations before doing an away, but if that's not the case for you and if that's not possible, I'll say don't worry at all. I think really a mandatory part of being a trainee is asking those dumb questions and getting answers to those questions. So and you might think, oh my gosh, that person is, the attending is totally going to think I'm stupid or something like that. And, they might for a second or two, but, they move on and they just forget, a few weeks down the road. So it's not a big deal at all. And I really find, I remember kind of holding myself to this like artificial standard I set for myself. Like I have to ask an informed question. If you can do that, great, but that's not going to happen all the time. And part of being in academics and part of being a trainee is asking questions to people who know better, so you can get trained. That's just part of being a trainee. So if you don't have home program, and if you were not able to get, set up a rotation beforehand, no worries. There are plenty of really great residents and attendings at other programs who are willing to teach you the skills, but you also have to put in your work of maybe like coming to the clinic early, or I, for example, like came on weekends to practice using a slit lamp with a friend. I thought that was enormously helpful. So there are some things that you can do as well.
Thank you. And I also see Lauren's comment that you are your biggest critic. So that also ties into what Grace has been saying. So don't be pressured and don't be frustrated by the pressures from your own perfectionism, and learn from everyone, be kind to everyone, even to the janitors, like Victor has said, and make sure to take your personal well-being and happiness into consideration, because in the end, that would be the strongest motivation that keeps you going while you're doing away rotations and even afterwards when you're pursuing your residencies at other states and other institutions. And I would like to take a step away from the stressful application cycle and first ask you this more happy question. What were some of your hobbies or other interests beyond ophthalmology and medicine? For example, Lauren, you said health equity was one of your strongest interests. And I would like to ask to all three of you, what were your other passionate areas and how did you relate that back into your ophthalmology interest?
Yeah, so, there is a section on the SF application where you can write down your hobbies. And, I'll say be authentic, be as authentic as you can. You don't need to write 9 hobbies. That's definitely, I think I had 2. And, those were things that I would engage on a very periodic and regular basis. Like, for example, I love weightlifting. It's been something that I've been doing for a long time. And, it's something that I've consistently engaged in over many, many years of my life. And it really helps me stay grounded. And I also like the more algorithmic side of things, where I can tweak some variables and, accomplish the goals that I want. So I wrote about that in my application. It has nothing to do with ophthalmology other than, but I like sheets to prove kind of my track record. And I included that Google Sheet link in my application. And I think some people took a look and, we talked about fitness, which was kind of fun during interviews. So hobbies do come up quite a bit during interviews. It's just a, human way to, relate to other people. I think we are all interested about what we all do for fun. So, be as authentic as you want to be. And you definitely don't want to, you don't need to have like this 1 in a million kind of hobby. If you have that, awesome. But weightlifting is as banal as it gets, and we still had great conversation about it. So, I'll say just be authentic.
Yeah, in terms of personal interests, like don't feel like you have to craft a narrative or craft something just for people to engage. Like people want to hear what you're genuinely interested in. And also there are going to be like some interviewers who want to make sure that you're genuinely writing things that you like to do. Like, for example, I wrote that I liked collecting vinyl records and I loved like vintage record stores. And somebody asked me what brand of record player I had. And I mean, obviously, like I knew the answer to that, but I think there are some people that want to make sure that what you're saying is authentic and you're not trying to think of something that's going to make you stand apart. So I think that's one thing. And then in terms of other academic interests outside of hobbies, I think Grace did a great job giving an overview of how to talk authentically about the things you genuinely care about. They don't have to relate to ophthalmology. One of my biggest things I spent time on during med school was developing a program with one of my peers that was a free program for low-income adults with obesity or who are overweight and wanted to make sustainable lifestyle modifications. And so that was something I worked on for 4 years. And it was one of my few extracurriculars because it took so much time and energy. And I loved talking about that because it showed my interest in medicine outside of ophthalmology, but then also like some skills in leadership and organizational development and strategic planning that I think will translate to being successful in residency. And I was able to make those connections too. So it's not as important to connect every interest you have back to ophthalmology, rather how you talk about it and how it's made you a leader, how you've learned from it, how you've grown from it, what skills you have that you can translate then to your experience as an ophthalmologist, a resident, and a leader. And I think those things are important to focus on too, because that was in no way related to ophthalmology. It was very much a primary care program, but I was very interested in it. And I did have takeaways that are going to translate to my career within ophthalmology and as a trainee.
Yes, I completely agree. And not all of your hobbies have to relate back to ophthalmology. In fact, they ask you this because they want to see that you're a person outside of ophthalmology. So, I mean, for me, mentorship is really important to me. I don't think I would be where I am today without my first mentor, who I talked about earlier. So I always try to find ways to pay it forward, whether it's being part of mentorship organizations that target pre-medical students. And now I'm doing more work trying to increase the number of underrepresented minorities going into ophthalmology and medicine in general. So I'm very passionate about that. I sit on like multiple organizations at my school that does that. So that's something that's really important to me, something that I talk about a lot. And it's not necessarily always related to ophthalmology. I help a lot of pre-meds. I talk to them on a regular basis. So that's something that I really care about. As far as my hobbies, I have a few, but I emphasize dance and music on my application. I'm really into that, and I used to play a lot of basketball in back when I was living in New York. We call it street ball. We just go to the parks and play, like just me and my friends. I wish I had more time to do it now, but I love playing basketball. So those are things that I'm really interested in. I I think, Lauren, what you said is super important. They will challenge you on your hobbies, and a lot of the time, like because these interviewers are people as well, uh, they will have the same hobby that you listed. So whatever you put down, make sure that it's something that you actually do and know well, because they will start if they share the same hobby as you, they're going to start asking you questions, and you don't want to be that person that doesn't know how to respond if because you sort of exaggerated the extent in which you're interested in that hobby. So just be genuine about who you are. It doesn't have to be anything outrageous, like there's some, or like really out there. I have friends who are like, oh, I'm a junior Olympian gold medalist. I'm not a junior Olympian gold medalist by any means. Like I play basketball for fun. Like I didn't play it on a team or like So don't exaggerate your hobbies. Um, don't feel like you have to come up with something uh, that's very, very like unique. Just be authentic. That's, I think, the key word. And I think being authentic and just being able to describe what about your hobby you like and why you enjoy doing it is good enough.
Yeah, and briefly too, something that can help even if you feel like your hobbies are more generic is to add specificity. Like that was some advice I got from somebody who applied the cycle before. Like, don't just say you love cooking, say what your favorite recipe is. Or I said I like to try new bakeries on the weekends, and I said my favorite one and what I like to get from it. Or just what my favorite record was, what my favorite concert was, where I liked to go rollerblading, and so I think that can be helpful as well.
Thank you. So the summary is to be genuine, be yourself, and show other qualities that you have through the hobbies. For example, consistency, like Grace attaching the sheet of her rate records and knowing the actual vinyl records, the types of it, because they may actually ask you and test you on your knowledge. And I also learned that it's important to have devotions to service, like the dedication that you have put into serving the obesity patients as well as the URMs. So those were all excellent qualities. So I respect you for that and thank you for sharing. So one final question that I had to summarize your entire 4 journeys in pursuing ophthalmology is what would be one thing that you would do differently and one thing that you recommend to everyone throughout the 4 years?
Man, this is always a hard question that always stopped me on the interview trails as well. I'll start with the easier one, which is something that I recommend to everyone. I will say interviews are so important. Like getting your application in is like half of the equation. The next half of the equation is really like conveying yourself well on interviews. And, I used to think that I was a terrible interviewee. But really just practicing with your mentor can be a really good way to hone your interviewing skills, and lots of internal reflection and jotting down key points to like common interview questions, what you're going to say. I know like I rested like a interview panel in the past, and but we talk about those skills more in depth there. But yeah, there are Google Sheets with like common interview questions. So I went through all of them, and then I think I jot down like major key points of what I would say. And really the key in interviewing really is to being authentic and conveying that authentic story in a consistent manner. So in order to do that, you have to know yourself really well. And that just takes time. So think about interviews early. Like, don't think about it like right around October when interviews come out, but give yourself like a few months to challenge yourself to come up with narratives and how you're going to portray yourself. Remember, you're just being authentic. You're just trying to convey that in the most consistent manner possible. In terms of what I would do differently, oh gosh, yeah, maybe this is a little similar to Lauren, but I would maybe study. I would, take preclinicals a little more seriously, and really try to perform as best as I could on all the tasks I could have. I feel like sometimes I was, distracted or consumed by, oh, this is like not as important because it's, whatever, not as relevant to ophthalmology, but really focusing on the task at hand is important. So that's what I probably tell my younger medical school self.
Yeah, those are both great points. I think something I would have done differently, which is so much easier to say, like in hindsight with rose-colored glasses of knowing our outcomes and being matched, but I worried a lot every step of the way. I always like feared how I was going to get to the next step. And I think especially knowing that for all of us, we kind of had an interest in ophthalmology early, and knowing that we had so much time to plan. And so I think even though I had a plan that I was sticking to, I was always worried about the next step. And first it was like doing well on shelves and doing well on clerkships. And then it was doing well on step. And I think it took me too long to be confident in my ability to do well. Even with objective measures, I still would fear the outcome of the next thing. So I think just really take those cues, like you're working hard and you're going to do well. And if you're consistent and motivated and believe in yourself, you're going to do well, and take those times where you do well as feedback. And also in moments that you don't do well, know that you have the resiliency and skills to improve, and it's not going to ruin anything. I think I did a lot of looking at those big milestones in medical school as do or die. And I wish I would have just kind of stayed the course and known that consistency and hard work were going to get me to where I wanted to be. And I would have saved myself a lot of worrying. And I learned that a little bit too late in med school. And then it's something that I would recommend to everyone is, especially if you know you want to do ophthalmology early, something that I think was important in my process was slow and consistent networking. I am not the most hyper social person that had the ability to just go and strike up conversations with PDs and people at conferences, nor did I really want to come across that way. I knew that I was lucky to be going to conferences early on. And so my goal was to say hi to people that I knew, somebody I had collaborated with on a project, somebody that I knew was a co-resident with a mentor, somebody that my mentor had introduced me to at the last conference. Just go and say hi. Or if there was somebody I wanted to meet, I would go specifically to their talk, say hi afterwards, with the condition that the next time I was at a conference they were at, I would also just say hi again and not use it as a way to gain something. Just slow and consistent networking was the strategy that worked best for me, especially as not being a super extroverted person. And it allowed me to build strong relationships over time and to start recognizing more and more people. And then I think also don't underestimate how important it is to meet the people that are in your peer group going through all of this. Like conferences each time got more and more fun and enjoyable because I would meet people like Grace and Victor on rotations, and then we'd become friends. And these people are going to be your professional community, but that also turns into a personal community when ophthalmology is such a small social specialty. And I think that was a really important added benefit that I didn't foresee, just making new friends along the way and making all of this professional academic stuff feel more fun and genuine and personable. So be yourself in those scenarios and don't be afraid to really interact with and get to know the people that are in your peer group and will be your colleagues for the rest of your career.
Right. I completely agree. I always find this question kind of hard because I have to sort of like reflect on the spot. But I think one thing that I wish that I had done earlier is actually go to like ophthalmology specific conferences before third year. And I think, excuse me, I think the pressure is, like you must submit an abstract to go to a conference. You have to like present research. Usually that helps because you can sometimes get grants to go and like, it helps cut down costs. But, like maybe if for whatever medical school you're at, like maybe try to see, are there conferences taking place nearby? Ophthalmology related conferences, whether it's, I mean, like a subspecialty conference for ophthalmology that's happening nearby where maybe it won't cost you much to go, even if you don't have research to present right then and there in that moment. You could just go, just go walk around, see some posters, talk to other medical students that are presenting. Sometimes they may be upperclassmen if you're first or second year, right? And these are people that you're sort of getting reps seeing over and over again at these different conferences who will then be residents by the time you're applying, right? So these are people who, like at least for me, like like seeing I like seeing the same people and say, oh hey, remember me? Like I saw you at that conference and whatnot, right? And like we'll catch up, and we help each other out. So, and also those goes the same for like residents that you might encounter at those conferences as well. Just sort of getting acquainted um acquainted with the people and getting acquainted with sort of like how these meetings go, like could be helpful. So yeah, I think that's something that I wish I'd done earlier on. I did a lot of it during third and fourth year, and even within those 2 years, I kept seeing the same people over and over again, and it was like really, really fun. And like when I go to a conference, I know exactly who to hit up and say, hey, like, do you guys want to hang out? Do you want to grab a meal, grab drinks, whatnot, catch up, so that's something that I've enjoyed, and I wish I had done sooner. It was a little bit hard, obviously, during first year because of COVID, but I wish I had done it a little bit more during second year. The one thing that I think has worked very well for me in medical school is, in spite of all the work that we have to do and all the stressors, I try to maintain my relationships with other people, like my friendships. I have some pretty strong friendships with classmates in my medical school. I have some pretty strong friendships with people from my college and my high school. I try to keep up with them as much as possible. Sometimes it's hard, obviously, because we're working all these odd hours for extended periods of time, but be intentional about be intentional about how you're spending time with other people. Because if you are not intentional about how you're spending time with other people, you will become isolated, and it can affect you. And it's always better to have those good relationships with other people, specifically people who lift you up, not people who bring you down. Um, because it's such a long process, it's a long road. Medical school and residency, you need the support, and you want to have that by being intentional about how you spend time with people who lift you up.
Thank you so much for sharing all the valuable advice that you have learned from your own experiences. We really appreciate your time and advice to the aspiring ophthalmologists. And once again, congratulations, and we wish you all the best in your next steps of your ophthalmology journey.
Thank you, and thanks for having us. This was great.
Thank you so much.
Thanks for having us.
Bye. Thanks.